Hi, today we're going to present a case about Allison. Allison is 17 years old and she presents with an acquired traumatic brain injury from a motor vehicle accident. Her family is very supportive, but they have limited healthcare experience. In high school, Allison is very involved with college preparatory classes. She's a member of her softball team, and she's also very active in the debate and drama club. In her community, she is part of her church youth group, and she also volunteers at a homeless shelter preparing meals. Some of the client factors affecting performance for Allison would be the following. First, I'm going to talk a little bit about her strengths. She's very cooperative and pleasant and very easy to work with. She's also oriented to space and time, and this will help with some of the interventions that we're going to talk about later. Right now, Allison presents with no motor impairments. Some of her performance skill deficits are decreased endurance, displays some cognitive and memory deficits, especially in visual memory, sequencing, multiple digit math, and also delayed executive functioning and concrete problem solving, mainly in mental flexibility and organizing information. What does Allison want? Based on the interview, here are the occupations that Allison wants or needs to do. Areas of occupation include education. Allison needs to go to school and she's expected to do her homework. Social participation, Allison wants to go shopping with her friends and also chat online. Work and community, Allison would like to return to her role in the community volunteering at her homeless shelter. Right now I'm going to present some purposeful interventions for Allison. Purposeful interventions have a specific and predetermined goals, and they facilitate practice and problem solving. This allows for integration of skills to accomplish desired occupations. One great thing about purposeful interventions is that they do not have to take place in the desired environment to be effective. Since executive functioning is a major deficit for Allison, I feel like the purposeful intervention stated above will target these deficits. Purposeful interventions. Educational interventions for Allison. Allison will practice math card games in a therapeutic setting. The targeted skills for this intervention will be visual memory, sequencing, and multiple digit math. Social participation intervention. Allison will practice having a conversation with OT regarding what type of clothes she likes. Targeted skills for this is going to be mental flexibility, conversation skills, and taking turns exchanging information, as well as social skills so Allison can get back to chatting with her friends online. Work and community interventions will be Allison will practice plating up her food in a therapeutic setting during breakfast and lunch. The targeted skills for this are going to be sequencing, mental flexibility, and endurance so she can get back to the homeless shelter serving foods. The literature does support purposeful interventions. One of the definitions that I found in her framework was just the definition of what an intervention is, and that is to provide assistance to the client in reaching a state of physical, mental, and social well-being, to identify and realize aspirations, to satisfy their needs, and to change or cope with the environment. I feel like the purposeful interventions I stated above will help Allison do just this. I also found a study that talks more about feelings of mastery and satisfaction are going to be higher when you have an activity that directly addresses the client's desires and their current skill set. This increase in mastery is going to lead to more positive outcomes in a therapeutic setting. The last study that I found was between two different scientists, and what they found was that with a traumatic brain injury, one of the most disabling aspects of this is the executive functioning impairment that clearly Allison is struggling from right now. With a traumatic brain injury, they found that the type of purposeful interventions that targeted specific behaviors were most effective in the interventions.
Thank you for that, Felicia. And while you present a strong case, I disagree.
Okay.
Occupation-based intervention is treatment that is desirable to the client, matches his or her personal goals, and occurs in its appropriate context. Typical occupations are used as therapy intervention. Occupation-based therapy should be done using a client-centered approach, which means gather information from the client about what is most important and meaningful to them. Based on what Allison needs to do, wants to do, and is expected to do, intervention should focus on the following. Allison needs to be able to get dressed. She should be able to get dressed in her own home, in her own room. This will help with sequencing, organizing, and picking out appropriate clothes for desired outings. She wants to be able to go to the mall with her friends. This will allow her to be social with peers and use simple math skills to calculate money to purchase items. Allison is expected to help with dinner and do homework at home. Doing actual homework problems will teach Allison sequencing, problem solving, and mental flexibility, and assisting her parents with dinner will help restore her skills for cooking at the homeless shelter. Treatment focused solely on performance components may fail to address volitional, attitudinal, and physical environmental barriers. The client's abilities to adapt to the environment may not be recognized if treatment is not occupation-based and done in the natural context. Occupation is meaningful and goal-directed and can affect an individual psychologically, emotionally, and socially in ways that purposeful activity unrelated to the person cannot. Occupation-based therapy is not restricted to the person experiencing occupational performance problems, but can also include people involved in supporting and caring for that individual, such as family and friends. Allison should be able to perform her occupations with family and friends who can provide support and encouragement.
Okay. Well, Amy, you make a really good point, but I still disagree with you. At this stage, Allison is not ready for occupation-based interventions. She needs more practice. And she needs more practice at the targeted skills that I mentioned above in a therapeutic setting first. If Allison does not get this practice and she's out in her natural environment and she has a failed attempt at completing these skills, because you pushed her a little too soon, I'm just afraid that she will suffer from decreased volition and feelings of mastery. In addition, the literature that I found clearly states that for loss of executive functioning for TBI patients, purposeful behavior and purposeful interventions are more effective. So with that, I'm going to have to stand firm on my original viewpoint that purposeful interventions are much better for Allison at this stage in her life.
Well, just because Allison can master practice of performance components in the clinic does not automatically mean that practice will transfer to the familiar environment of her home. Being in a familiar environment with family will help provide encouragement and increase her volition. Treatment should be collaborative based on the client's occupational goals for life and not just goals for treatment.
Okay. Nice talking with you. The end.